Honorable Chairpersons, my dear friends, I'm going to speak on correlating ocular features with serum VEGF-D and other inflammatory factors in COVID. The prevalence of ocular manifestation is 2 to 32%, and the spread is of the viruses from the mucous membrane. However, the inflammatory factors mediate the inflammation and cause severe systemic involvement as well as also involvement of eye. Huang and Kong et al. Studied that VEGF levels are elevated in patients of COVID, and they were correlated with sequential organ failure assessment. However, they did not study the ocular features. Wu et al. Studied ocular features and found that LDH and CRP and other inflammatory factors were elevated. Seeing the paucity of literature, the aim of the study was to evaluate ophthalmic manifestation and correlation with serum levels of vascular endothelial growth factor D and other inflammatory factors in COVID recovered subjects. There are very few studies on this. The study was approved by Institutional Ethical Committee and informed consent was obtained from the participants. Carried at Department of Ophthalmology, Guru Nanak Eye Center, Maulana Azad Medical College, as an observational study on 160 eyes of 80 COVID-19 recovered subjects to evaluate serum VEGF-D levels and C-reactive protein, LDH, D-dimer, and ferritin. Subjects having significant ocular diseases and central nervous system diseases or other ocular surgeries other than uneventful cataract surgery were excluded. History was taken for diminution of vision, redness, irritation, foreign body sensation, and examination was done for best corrected visual acuity, intraocular pressure, dilated fundus examination, color vision, contrast sensitivity, OCT and OCTA, and 3 into 3 millimeter macular scans. 54 males and 26 females with mean age of 50 years, however, they did not have any ocular symptoms. The distance best corrected visual acuity was less than 6 by 60. Intraocular pressure mean was 17. The slit lamp did not show any anterior segment inflammatory features. The Ishara's plate showed normal results in majority of patients. Farnsworth showed 28, 26, and 21 to have mild, moderate, and severe trypanopia. Contrast sensitivity was within normal range of 2. The central foveal thickness was 245, and the levels of VEGF-D were almost double the levels reported as normal in normal healthy subjects. The picture shows this VEGF-D that surprisingly it is most studied parameter in the ocular diseases, did not have any significant correlation with the ocular parameters as mentioned in the left side. The CRP, LDH and D-dimer, they had negative correlation with the near refractive error, meaning that if their level was high, the subjects had better near vision. The CRP had positive correlation with contrast sensitivity, and LDH had positive correlation with good results on the Ishara's red-green plates. So if they were high, this means they were better results and higher contrast sensitivity. However, the foveal thickness was more if LDH levels were high. The D-dimer were negatively correlated with the best corrected visual acuity and negative correlation with the Farnsworth test. So higher levels indicate that worse distance best corrected visual acuity and more errors on the Farnsworth. The ferritin was having a positive correlation with the distance refractive error. This means higher the levels, more the error, and worse is the distance best corrected visual acuity. On the octa parameters, the phase parameters, they had negative correlation with the levels. This means higher the levels, lesser is the phase area, foveal avascular zone area, and lesser is the foveal avascular zone perimeter, which indicates better health. And higher the vessel density in superficial capillary plexus, deep capillary plexus, outer retina choriocapillaries, that negative correlation means higher, sorry, that positive correlation means higher the level, more is the vascularity. So this, if vascularity is high, this does not necessarily indicate good health, rather it may be indicating more inflammation. Thank you.
So you're saying these high values actually improved their near vision, some of these patients.
Yeah.
And how do you explain that?
These inflammatory factors also raise the vascularity, and if the vascularity is better, then the blood supply to the photoreceptors increase. There are certain acupuncture and acupressure treatment and yoga treatment which increase the vascularity of eyes in order to increase the vision. So I'm explaining in that basis. And secondly, it is seen in the literature that in earlier phases the adverse effect of these inflammatory factors may not be visible. Since I had studied at only one stage these patients, maybe if I may have followed up for 3 months, their ocular parameters would have gone down.
But your conclusion was that vascularity does not mean that there is improvement. That is what your conclusion was.
Because our general perception is that if the person is, because this is just one stage study. Maybe if I would have studied initially,
no,
there may be
study
increase.
they improved, no? Did you correlated those patients and that vascularity increased?
Yeah.
So it was improvement. So why did you conclude that there is no improvement?
No, it is like, that suppose we take caffeine and it improves the performance for some time, but later on it may deteriorate. It is, if we think that if the vascularity of retina is more, then a person is healthy. But if inflammation also, the vascularity will increase.
Thank you.
Thank you.
Dr. Pallavi Sinha is not present. Okay, thank you. So with that, we conclude the session. I'd like to thank all the speakers for an excellent presentation.